My name is Jasmine Waslowski. I'm currently a PGY2 in family medicine at Dalhousie University, based at the Inverness Cape Breton site. I went to medical school in Toronto at the University of Toronto. I was actually on the Mississauga campus, and I grew up in a town outside of Toronto called Caledon, Ontario. Rural medicine is something that initially drew my interest because of my desire to not want to live in a large city. I like the quieter lifestyle of a rural town, and I also like the kind of close-knit community aspect of it. As I went through medical school, I was kind of drawn to it more as well, related to the practice style of rural family physicians. I think it's a very challenging practice where family physicians have a bit more independence, and they tend to have a broader scope of practice as well. So for myself, I like kind of being busy doing a variety of different things. I like being able to work in the emergency department, but I don't want to exclusively work in the emergency department. Similarly with hospital inpatients or obstetrics. Rural family doctors have the opportunity to kind of cater their practice in different ways, and even more so than that, be able to kind of be a jack of all trades and wear many hats. So Dalhousie Family Medicine is a distributed program. My residency site in Inverness has 2 residents per year, so a total of 4 residents. We are kind of linked with the Cape Breton regional site in Sydney, which I believe has 5 residents per year. So I think, or maybe 6. It's a total of kind of 6 to 8 for all of Cape Breton, Nova Scotia, but Dalhousie has multiple sites that residents can join, some of which are integrated longitudinal programs, and some of them are block-based, so just depending on kind of what you're interested in. I'm not sure what the total number of residents are for all of Dalhousie Family Medicine. My favorite thing about the Inverness site, specifically in my residency program, is the integrated and longitudinal nature of it. I think it mirrors real kind of rural family practice really well, and it's also a very flexible program. So kind of on a weekly basis, I could be doing 3, sometimes 4 different things. On one day I'll be, or 2 to 3 days a week, I may be in the family medicine clinic. Every morning I might round on inpatients if I have any. Usually I have an emergency shift at least once per week. And I have the opportunity to work with visiting specialists in an integrated way. So it's kind of a good way to be doing, I guess, kind of keeping up different skills along the way, rather than sort of like, doing your hospitalist rotation and then you never, take care of a hospitalist inpatients for another year. This way it's kind of integrated throughout. So I really like that aspect. And then also the flexibility aspect of the program. First of all, I think because it's a fairly new program, there's certain tweaks that I guess are still being worked out, but also I find the preceptors are really flexible and the administrators are really flexible. So if I have sort of specific areas of learning that I feel like I'm not getting, then the program will work with me to try to find opportunities to get that learning. And sometimes, and I think oftentimes, that means going to our kind of regional site, Sydney, to maybe work with specialists on something, because unfortunately we don't have a lot of specialists in Inverness, but the good thing is that, like I said, it's very flexible. So whenever there is a gap like that, it's easy to fill. That's a tough call. I think it would be somewhere between clinic and ER, but I wouldn't want to kind of just choose one. I like OB. Unfortunately, it's not available in my program, like at my site. So I think it's nice to have it in an integrated way, but it's not integrated for me. Yeah, I think probably clinic and ER would be my favorite, but I would never want to have to choose one. So my main kind of, I guess, extracurricular interests right now are in the Society of Rural Physicians of Canada. I'm a member or a co-chair of the resident committee. So that's a team of residents that promote rural medicine amongst medical students and also support residents who are in rural programs or are interested in working in rural areas. My other kind of area of advocacy or interest that I've sort of been trying to foster a bit more this year is around environment and climate change. So I've been a part of the Canadian Association of Physicians for the Environment, Nova Scotia, I guess, group, doing work around some political advocacy and just learning more about the role of physicians in environmental justice and promoting resilience and adaptation and so on. And then similarly, I have a role with that within the Society of Rural Physicians as well. So that's kind of those are my main two areas of focus right now. My favorite, I guess, activities to do in my free time involve something outdoors. So I guess hiking would be, if I had to choose the one thing. There's a lot of national parks. Well, there's one major national park in Cape Breton that has a lot of amazing hiking, and then there's some other kind of local provincial parks and other hiking trails that I enjoy. But also there's like cycling, and there's an amazing beach in my area that I like to spend time at. And lately I've been having a bit of a green thumb and trying to do some gardening as well. So as much opportunity to get outside is what I would like to do. So I've always planned on working rurally. When I chose to come out to Inverness for residency, my partner and I sort of decided on a bit of a 5-year plan. And so at this point, we're planning on sticking around here in Inverness. It's a great community of physicians. The healthcare team is fantastic to work with, and just the nature and the community itself is really lovely. So that's kind of my initial plan anyways, and we'll kind of go from there. Yeah, I look forward to the broad scope of rural practice here. I think looking for mentors is a big thing. So I know a lot of residents, for example, that are more than willing to meet with medical students and talk about their experience in their residency program. Similarly, within the Society of Rural Physicians, there's several very well experienced rural docs who are interested in sharing their experiences. Every rural town is a bit different. There's definitely similar themes, but I think trying to kind of meet as many people who work in different practice environments, see what they do, and then if possible, organize, electives or shadowing or rotations in rural environments is the best way to get that exposure. Most rural towns are just thrilled to have learners and are thrilled to have the opportunity to recruit you to join their community. So I don't think the great thing about rural medicine is that it's not sort of a cutthroat, competitive specialty to apply to. I find it's very supportive, but there are a lot of kind of ways to learn about it, and I think that's, I guess, as a medical student, the main goal. So if anyone has questions for me, hit me up. Yeah.